Welcome back, everyone. We're diving into some fascinating notes today, all about renal medications.
Yeah, it's going to be a good one.
You guys have really outdone yourselves this time. We've got everything here from immunosuppressants to, well, stuff to help with bladder
A
control.
little bit of everything. It's pretty amazing,
All
actually.
right, it's like a whole world of medications just for the kidneys and the urinary system.
Mm.
Before we jump into the specifics, though, I just got to ask, what's the most surprising thing you've learned from these notes?
Hmm. That's a tough one. I think what gets me is how targeted these medications are. Like each one is designed to affect very specific processes.
Absolutely. It's not just about masking symptoms. It's about really getting in there and managing some pretty complex conditions.
Right, exactly.
Okay, so before we get too deep, I have to bring up the mnemonics. Some of these are, well, pretty creative. AZA zaps the immune system.
Oh, yeah, those are fun.
Catchy, right?
Right.
But azathioprine, that's serious business when it comes to organ transplants.
Absolutely. I mean, that mnemonic does highlight its main function,
Yeah.
suppressing the immune response to prevent organ rejection.
Right. But when you think about it from the patient's perspective, they're basically more vulnerable to infections because of that.
Yeah, it's a delicate balance.
So for someone going through a transplant, understanding those risks,
Yeah,
that's crucial.
for sure, for sure.
Okay, another mnemonic that caught my eye. Bethany's bladder is back in action. Athanical. This is for urinary retention,
Oh,
right?
yeah. That one always makes me
I
smile.
know, right? But on a more serious note, how does it actually work? What's happening at the receptor level to, get those bladder muscles going again?
So basically, it stimulates these things called muscarinic receptors. Think of them like tiny switches that tell your bladder muscles to contract and empty.
Okay, so it's not just a funny name. It's actually targeting very specific mechanisms.
Exactly. And for someone struggling with urinary retention, this medication can be a game changer.
Right, but like any medication, there are those potential side effects to keep in mind.
Oh, definitely. Low blood pressure, even bronchospasm in some cases. It's a good reminder that these medications, even the ones for seemingly simple conditions, are powerful.
Absolutely. And speaking of powerful medications, let's talk about calcium and phosphate. Especially for people with chronic kidney disease, that balance is so important.
Yeah, it's a tricky one.
And you've got notes here on calcitriol and calcium acetate. Two very different approaches, right?
Yeah, they work on opposite ends of the spectrum, you could say.
Right. And you even have mnemonics for these. Calcitriol equals calcium control. That one's pretty straightforward. But how does it actually work? I mean, for someone with CKD, how does calcitriol help manage those calcium levels?
Okay, so think of calcitriol as a helper for your intestines. It's basically a form of vitamin D. And what it does is it increases calcium absorption.
Oh, so it's bringing those levels back up.
Exactly. And for someone with CKD, where the kidneys are struggling to regulate calcium, that can make a big difference.
And then you have calcium acetate, working on the other side of things. Phoslo equals phosphate low. So it's binding to phosphate in your food, which means less gets absorbed into the bloodstream.
Right, and that's really important because high phosphate levels in CKD can lead to a whole bunch of problems. Everything from weak bones to heart issues.
And you've got a note here about high calcium, too. That mnemonic control makes a lot of sense now. Hypercalcemia, not something you want to mess with.
No, not at all.
No.
We're talking kidney stones, nausea, even muscle weakness in some cases. So these medications, they're not just about numbers on a lab test. They have a real impact on someone's quality of life.
It's about keeping that balance, right?
Exactly.
Okay, let's talk about a heavy hitter, cyclophosphamide. Cyclo equals cycle of killing immune cells.
That's a good one.
Intense imagery, right. And for good reason. This is for serious autoimmune conditions affecting the kidneys, isn't it?
Yeah, things like nephrotic syndrome or lupus nephritis,
Yeah.
conditions where the body's immune system is basically attacking the kidneys.
Yeah.
And what cyclophosphamide does is it stops those immune cells from replicating, which is why it's so effective.
Yeah.
But
Like we've seen with other immunosuppressants, there's a price to pay for that effectiveness.
right, the potential side effects can be pretty serious, like hemorrhagic cystitis, for example. That's not something to take lightly.
Absolutely not. And that's why this medication is used very carefully, under close supervision. But for someone facing kidney failure, because of an autoimmune disease,
Yeah, it can be a lifesaver.
it makes you realize how complex these decisions are, balancing the benefits and risks for each individual patient.
It really does.
Now, let's switch gears to something a little more familiar, enalapril. It's prescribed for high blood pressure, but why is it on our list of renal medications?
Because high blood pressure is one of the biggest risk factors for kidney damage.
Oh, okay, I see.
And enalapril, because it's an ACE inhibitor, it helps protect those tiny blood vessels in the kidneys, which is especially important for people with diabetes because they're already at increased risk.
That makes sense. And I remember that mnemonic you had for it. April ACE stops high BP chill. But what about those side effects, like the ACE inhibitor cough, for instance?
Yeah, that's a common one for sure. And you've also got to watch out for potential potassium buildup, which can be a problem for people with kidney issues.
So it's like a constant balancing act, isn't it? Managing the blood pressure, protecting the kidneys, but also being mindful of those potential side effects.
It is.
High blood pressure is called a silent killer for a reason, though, right?
Exactly. It often has no symptoms until it's already causing damage.
So for a lot of people, enalapril is crucial, both for their overall health and for their kidney function.
I'd say so.
So we've covered medications that suppress the immune system, things to manage bladder function, and now even something to control blood pressure and protect the kidneys.
Mhm.
But you've also got a whole section here dedicated to medications for overactive bladder, incontinence, and even UTI pain. It's like,
A whole toolkit for the urinary
oh,
system.
exactly.
It's a big area for sure. And, it's something that can really impact people's lives. Dealing with those kinds of urinary issues, it can be so frustrating.
Oh, absolutely. It's not just a minor inconvenience, it affects your whole day.
Exactly. And the good news is there are so many different medications now to help with these problems.
Right, and I'm seeing a lot of familiar names here. Flavoxate, oxybutynin, fenylpyridine,
Yeah.
even propanthyline bromide.
Yeah, you've got like anticholinergics, antispasmodics, that different tools for different jobs, really.
Okay, so how do you know which one is right for a particular person? I mean, is it just trial and error?
Not necessarily. It's more about like understanding the specific symptoms someone is having. What's their medical history? What other medications are they taking? That kind of thing.
Right, because some of these medications can have interactions, right, or they might worsen certain conditions.
Exactly. Like someone with an overactive bladder, they might benefit from something like oxybutynin, but if they also have glaucoma, that could be a problem.
Because some of these meds can make glaucoma worse.
Exactly. So it's super important to, talk to your doctor. They can help you figure out the best option for your specific situation.
And speaking of, finding the best option,
Mhm.
let's talk about side effects. I remember that mnemonic pyridium equals P turns red-orange.
Oh, yeah, that's a classic.
I mean, it's harmless, but definitely memorable.
It is. And it's good that it's something noticeable because then people know the medication is working.
Right. But what about other side effects? I know some of these meds can cause dry mouth, dizziness.
Yeah, those are common ones for sure. And some people even experience blurred vision, which can be a bit scary.
So it's not just about finding relief. It's about finding relief that doesn't come with a whole new set of problems.
Exactly. It's a balancing act.
Okay, let's shift gears a bit. We've talked about bladder control, but what about electrolyte imbalances? Specifically, high potassium.
Hyperkalemia, right?
Right, and that's a big one, especially for people with kidney disease, because potassium plays such a crucial role in muscle function, including your heart.
Exactly. So if those levels get too high, it can really mess with your heart rhythm, even be life-threatening in some cases.
So this isn't just about a number on a lab test, it's about keeping your heart beating properly.
Absolutely. And for people with CKD, they often struggle to regulate potassium levels, so medications like sodium polystyrene sulfonate can be a real lifesaver.
And you've got that helpful mnemonic here, K exchange equals low K. So it's basically swapping sodium for potassium, getting rid of that excess.
Yeah, that's a good way to think about it.
Okay, let's talk UTIs.
Yeah.
I know we can't give medical advice here, but I'm seeing so many options in these notes. Nalidixic acid, nitrofurantoin, sulfasoxazole. It's like a whole arsenal against those pesky bacteria.
It is, and each one has its pros and cons. Some are better at targeting certain bacteria, while others might be better tolerated by certain people.
Right, and I'm remembering that mnemonic nitro turns P yellow. Is that just a weird side effect, or is there more to it?
So it's actually because of the way nitrofurantoin is broken down in your body. It's harmless, but yeah, it definitely lets you know the medication is doing its thing.
Makes sense.
Huh.
And then we've got sulfa equals stay hydrated. Is that just general advice, or is there something specific about sulfasoxazole that makes hydration so important?
It's especially important with the sulfa drugs, like sulfasoxazole. They can form these crystals in your urine if you're not drinking enough fluids.
Oh, ouch. Kidney stones.
Exactly. So yeah, staying hydrated is key.
Okay, so it's not just about taking the medication, it's about knowing how to take it safely.
Absolutely. And that goes for all of these medications we've talked about.
So much of this comes down to patient education, doesn't it?
It really does. I mean, knowing how to take your meds properly is just as important as knowing what they do.
It's about being an informed advocate for your own health.
Exactly. And, that can make a huge difference in how well those medications work and how safe they are.
It's a partnership, right, between you and your doctor.
Yeah, for sure.
Okay, so we've covered a lot of ground here. We've talked about medications that suppress the immune system, meds to manage bladder function, even something to control blood pressure and protect the kidneys. Plus, all these options for overactive bladder, UTIs, and electrolyte imbalances. It's amazing what these medications can do. But I'm curious, how do they actually play out in real-life situations? Yeah, how do these abstract mechanisms translate into real-world outcomes for people dealing with kidney issues?
That's a great question. And that's one of the things that makes this whole field so fascinating. It's not just about the science, it's about the people. It is. And I think one of the best ways to really understand that is to look at specific cases, like case studies, because then you can see how these medications are actually used in different contexts, how they can make a difference in someone's life.
Okay, so case studies. Let's do it. Let's say we have a patient, early 60s, just received a kidney transplant. What kind of medication journey are they likely facing?
Well, first and foremost, they're going to need immunosuppressants, you know, to prevent their body from rejecting that new kidney.
Right, because their immune system is basically going to see it as a foreign invader.
Yeah, exactly. And so something like azathioprine, which we talked about earlier, that's often a first-line choice.
Zaps the immune system.
There you go. But like we said, suppressing the immune system like that, it comes with risks.
Right, increased risk of infections.
Exactly. So this patient, they're going to have to be super careful about their health. Any sign of illness, they need to report it right away.
And I'm guessing they'll need regular blood tests, too.
Oh, yeah, absolutely. To monitor their immune function, make sure the medication's working properly. It's a lot to manage.
It sounds like a really delicate balance.
Yeah.
And are there other medications they might need in addition to azathioprine?
Yeah. A lot of times they'll be prescribed corticosteroids as well, like prednisone, for example.
To further suppress the immune response.
Right. And these are strong anti-inflammatory drugs, but, long-term use can have some side effects.
Like what?
Weight gain, mood swings, even bone thinning in some cases.
Wow. So it's not just about preventing rejection, it's about managing all these potential complications as well.
Exactly. And, each patient's different. The choice of medications, the dosages, it's all going to be tailored to their individual needs.
Okay, let's switch gears a bit. Imagine a patient, late 70s, dealing with overactive bladder. What kind of medications might help them?
Well, we talked about oxybutynin earlier. Relaxes those bladder muscles. But in older adults, you have to be careful with that one.
Because of the side effects.
Yeah. Like dizziness, confusion. They can be more sensitive to those kinds of things.
So are there alternatives that might be a better fit?
There are. Tolterodine, fesotoroidine. They work in a similar way, but with a different side effect profile.
So again, it's about finding that balance, right?
Yeah.
Effectiveness and safety. Okay, let's try another one. Patient in their mid-40s comes in with a UTI. What's the typical approach?
Well, the first thing is going to be antibiotics, to clear up that infection. We talked about some options earlier. Nitrofurantoin, sulfasalazole.
Right, but which antibiotic you choose, it depends on the specific bacteria causing the infection, right?
Exactly. And the patient's medical history. Some people might be allergic to certain antibiotics.
And I'm remembering that mnemonic, sulfa, equals stay hydrated. That seems especially important with sulfasalazole.
It is. Those sulfa drugs, they can be tough on the kidneys if you're not drinking enough fluids.
So that's a good reminder. And of course, with any antibiotic, you got to finish the whole course, right?
Absolutely. Even if you start feeling better before you're done.
Okay, last case study. Patient in their late 50s managing chronic kidney disease. What kind of medication challenges might they face?
Well, one of the big ones is maintaining that electrolyte balance, especially potassium levels. We talked about how high potassium can be dangerous for the heart.
Right. K exchange equals low K.
Exactly. So sometimes medications like sodium polystyrene sulfonate are necessary, to help remove that excess potassium.
But is medication always the answer in this case?
Not always. Sometimes dietary changes can make a big difference too, limiting high potassium foods.
Like bananas, potatoes.
Yeah, things like that.
So it's a combination of things, really.
Right.
Medication, lifestyle changes.
It's all about finding what works best for each individual patient.
These case studies, they really bring it all to life, don't they? It's not just about these abstract mechanisms. It's about how they actually impact people's lives.
I think so, yeah.
It's a reminder that medicine, it's not just a science, it's an art too.
Absolutely.
And the field is constantly evolving, right?
Okay.
New research, new discoveries.
All the time. And, that's why it's so important to stay informed, to keep learning.
So for anyone out there who's dealing with a kidney condition or knows someone who is, there's always hope.
That's a great point. There's always hope, and there's always more to learn.
And we'll be here to help you navigate it all.
Absolutely.
Thanks for joining us for another deep dive. We'll be back next time with more fascinating insights from the world of health and medicine. Until then, take care.